Hello and welcome to The Insider. I'm Lisa Adams. For the last several weeks, our insiders have been coronavirus focused through the lens of different organizations here in our region. Today, it's a major hospital system. My guest is David Gibbons, who is president of UPMC Hamot. Welcome to Mr. Gibbons via our iPad stand-in here.
Thank you.
And also welcome to all of you watching at home or listening on the radio. So we'll begin our discussion today with the first steps that you had to go through at UPMC Hamot as the coronavirus pandemic bubbled up to protect your staff and the public. I think it really settled into the average person kind of slowly because you're thinking, it's in China, it's in Seattle, or it's on that cruise ship. So when did you as a hospital system understand the potential of this and start making preparations?
Yeah, that's an excellent question, Lisa. At UPMC, we have recent experience preparing for infectious diseases such as Ebola, H1N1, SARS. All of these have been recent. We continually screen for emerging infections and have for decades. In developing our COVID-19 preparedness measures, we started ahead of the curve, which is important, building from what we've learned from these previous epidemics and pandemics. We know the virus entered different geographical areas at different times and with different intensities. That likely means that one single strategy would not have worked at one time at every single location. And there's likely no one path. What we do know is that what we did locally seems to have had an effect already. We are in regular contact with our partners at the local authorities and state, federal, and public health authorities. When we have questions, I think it's important for the public to know that we receive very prompt replies, and we certainly appreciate their guidance.
Talk a little bit about the beginning of testing here in Erie. That seemed a little bit bumpy where people just weren't sure what to do if they thought they had symptoms or they had to kind of go through a series of steps to get approved for testing. How did you prepare your staff to face that risk? Because I assume some people did just show up at the hospital.
Sure. UPMC Hamot, we certainly have been steadfast in keeping, first and foremost, the public and our staff safe. From our visitation policies to our screening process of everyone who enters the hospital, including staff, it is our number one priority. For our outpatients, our video visits allow us to provide safe and ongoing care for many different needs, including unscheduled care, primary care, cancer care, long-term care. It really is serving our patients and our partners very well. And we have convenient video visit options and capabilities no matter what you need, from urgent care or non-urgent care, but necessary care. And the video monitoring, the video visits have been very, very effective.
Yeah, so we have a little bit of video of the day that Red Letter Hospitality delivered some food to the healthcare workers there at UPMC Hamot. I know the Cracker Barrel has done a similar thing. So I know you had to take steps to protect just the regular public from coming in to visit their mom or their dad or their sister or their brother or whoever was in the hospital having a procedure. So talk about how you had to restrict visitors, how hard that's been, and if you think it's working.
Yes, first and foremost, I do believe it is working. What our first step is we restricted the access points to the hospital. So there are 2 entry points and 2 exit points to UPMC Hamot. The one is always there for the patients first and foremost, and that's the emergency department, but only patients and a visitor are permitted in that entrance. The second entrance is in the main lobby, and then the third entrance is in the women's hospital. At each of these entry points, there is screening that occurs. We offer hand sanitizer. Each person is provided a mask, a surgical mask, and we are staged with lines that are 6 feet apart, both to your side and in front of you and behind you. And there's screening that takes place with a thermal temperature checks, as well as a list of screening questions. And I will say that the public and certainly the staff have been very cooperative, and they've been very appreciative of this. And this really is a dramatic change from 6 weeks ago.
How tricky is that whole thing, though, knowing that some people could have COVID-19 and be asymptomatic, even though you are taking all those steps?
Sure. There are patients, there's no doubt, and certainly we know there are patients who are asymptomatic, but we do hope that the screening questions, certainly that are promoted by the CDC, are effective in that if you do have a known exposure, and many of our patients and visitors, they've had exposure to individuals with influenza A or B, and they're very forthright in sharing that information. And again, on a daily basis, we're screening each visitor, and also we're screening our patients and our staff. So I do feel comfortable that we are taking the necessary measures, and we will continue to do so until we have further word from the public health authorities.
One of the things I think that's been most confusing for people in the public is this question of testing. When you test, if there are enough tests, and we're going to talk about that when we come back.
Right.
I'm Lisa Adams. Welcome back to The Insider. We're talking about progress in the fight against the COVID-19 coronavirus through the lens of UPMC Hamot today. My guest is the president of Hamot, David Gibbons. Thanks again for being here, and thanks to all of you who are watching and listening on the radio too. So let's get to testing in our community. UPMC didn't initially have a freestanding test site. Talk about why you decided pretty quickly that you needed to develop that and how that's working out.
Well, it's a great question. Certainly it was essential for us to provide a collection center, and the Lear building was an ideal site and was transformed from a storage facility to a collection site in 1 week's time. We constructed a negative air pressure facility with a separate entrance and a separate exit. Those who administer the test have the proper personal protective equipment, and our supply of tests certainly is adequate. And we're testing now on an average between 25 to 50 people daily.
Wow. And of course, there are other test sites in the region too, that AHN St. Vincent has a test site too, and some people through their personal physicians and so on. But there's still some confusion. We keep hearing in the national news if we only had enough tests, but you can't give a test to everybody unless they're symptomatic, right? Because if they thought, oh good, I don't have it, that doesn't mean they wouldn't contract it the next day.
Yeah, absolutely. The test is really best at detecting the virus in those who are symptomatic. And we want patients to be symptomatic because a negative test won't provide the best information. It could be a false sense of security. And people with the mildest symptoms, we recommend staying at home and self-quarantine.
So I'm curious about that too. I know the county executive has talked a lot about that, but what does that do to our data or our numbers here? Because if those people do stay home, self-quarantine, and they're never tested, will we ever have a real accurate picture of how many cases we had here?
Certainly, no, a very good point. And that, certainly has been the concern in the, on a national level, is the availability of testing balanced with the shortage of testing supplies, the swabs, the media, etc. I do feel comfortable to share with the public that we do have an adequate supply right now at UPMC Hamot, and we do evaluate the patient before testing is approved, and certainly asking questions, screening the patient with the standard questions of a cough, a fever, shortness of breath, travel history, known exposure, etc. But it is important, and I do believe in the very near future that we will test patients beyond the COVID-19 test, whether they're antibody testing, looking at serology, seeing that if a patient has exposure and does have the antibodies for COVID-19. And I think more information will transpire over the coming months.
Just as people talk among themselves, I think a lot of people have that, could that little couple of days I didn't feel well, could that have been it? Could I have had a good resistance to it? And they do want to know if they have the antibodies, but it's not even clear if you had it that you might not get it again in a more severe case yet, right?
Correct. The research is still ongoing, and certainly, I'm proud that UPMC is at the forefront of that research, but the research is currently underway, and we will learn more over the next several months regarding the COVID-19 pandemic.
And just today, the day that we're taping, I learned that the FDA has approved a saliva test now. As you said, this is changing day to day, the ability to test and ways to test. My understanding of that is it might be safer for your staff, for example, if they didn't have to be so close to someone swabbing them or have to change their protective gear so frequently if you just were, giving a saliva specimen. So how is that to be working in this environment where it's changing all the time?
Yeah, well, that certainly has been one of the dynamics of this story, is that it has been an evolution of change, and the team at UPMC, Hamot and UPMC, we say that this story does change oftentimes by the second. I now feel that the story is changing daily, so we are advancing our progress in the management of this. Certainly, as you mentioned, the saliva test that was FDA approved. From the time that it's FDA approved, and then certainly to providing the products, the testing, media, etc., it does take some time. And again, that's, our friends in media, certainly we appreciate that you're keeping the public informed, and we are working very closely with the CDC, the FDA, and other organizations, and we'll implement these tests as quickly as possible.
So we know you have the freestanding test site, but I assume there's still tests going on in the hospital, especially when people come in and are very sick. And so we hear people complain about how long it takes to get their results. Are you doing a faster type test in the hospital, or is it the same test you're doing at the test site?
Yeah, so excellent question. So we are fortunate. We have an amazing laboratory team at UPMC Hamot under the leadership of Dr. Dopowski, and they have secured the ability to conduct a rapid PCR or COVID-19 test for inpatients here at Hamot. This process is reliable, and it's also very sensitive. We are able to get the results for hospitalized patients in less than an hour, and this allows for the best placement of the patient, and it also helps us conserve the personal protective equipment, or we refer to it as PPE. So that test is available at Hamot for inpatients.
Well, you have alluded a couple of times to being part of the UPMC system, and we're going to talk a little bit more about what that means for all the hospitals in that system when we come back. Welcome back again to The Insider. We're talking about progress in the fight against the COVID-19 coronavirus through the lens of UPMC Hamot with its president, David Gibbons. And we welcome all of you back as well. So what is it like to be a part of a hospital system such as UPMC? How are you kept abreast of everything that's going on? Because they have announced that they're doing some major research there.
Right. It truly has been amazing, and I think for the public, it's very rewarding for me. I'm very proud of the system, but our physicians and our frontline staff are sharing their pride in working at UPMC. We have daily meetings from our central command center in Pittsburgh to all of the hospitals and the entities of UPMC. We participate on those calls. The information is shared in real time through those calls and on our InfoNet, which staff and the medical staff refer to daily. We, as a large system, this affords us really a broad geography, and we have the ability to confront this challenge as a 5,500 bed system. so not as an individual hospital or standalone hospitals.
So if I can jump in there, does that mean you're not just receiving on these calls, but the physicians and nurses at UPMC Hamot are giving input back to decisions that are being made, or data back as well?
It definitely is a two-way communication. Now, the two-way communication is with myself and Dr. Beard, who's our Vice President of Medical Affairs. He is the Chief Medical Officer. So we are the conveyor of information on these calls. Each hospital reports out their updates. So it is a two-way process, Lisa.
I know you haven't been wanting to give specifics about how many people are hospitalized under treatment for COVID-19, although I know there have been some. We don't believe there are too many in Erie County just because of our stats that we get from the county executive. But can you give us kind of a broad view, system-wide, of how many people are being treated at UPMC hospitals for COVID-19?
Sure. At UPMC, throughout our system, there are 90 inpatients who have COVID-19 at various levels of care, from obviously a medical floor to intensive care unit. And we monitor those statistics very, very closely. I think what's most important for the public is that the hospital is the safest place for a patient. The patient is protected. Our staff is protected. The patients are in a negative airflow environment, which is the highest level of safety, and we have the appropriate protective equipment to provide care for these patients.
So, competition in the United States is a positive thing, and it certainly seems like hospital systems are really rushing to develop ways to treat this, and UPMC has announced both a vaccine, a Band-Aid type of thing, as well as some clinical trials with hydrochloroquine and some of these other therapies. So talk about that, and if UPMC Hamot is part of those things in any way specifically.
Sure. No, it's really many prideful moments at UPMC in recent weeks. Certainly, as you said, with the vaccine, and on our announcement last week with a different approach to clinical research. The vaccine is a microneedle array using tiny little needles on a Band-Aid. So the advantage of this type of a vaccination is that it's one that's easy for us to replicate. It's very scalable, and we currently are in direct contact with the FDA and plan to begin safety testing in patients in a matter of weeks. And this process normally can take months or years to complete. And as we roll this out, and certainly the detail will follow with participation and where the people who participate in the studies, how far that geography will span. And as soon as we have that information, I will certainly share that with you and the media. And the research, looking at hydrochloroquine and the other drug therapies that are available, we are conducting numerous research projects right now through a centralized process, all embedded into our electronic health record, and collaborating with other countries as well. So there will be more information to share with the public in the near future regarding the research efforts.
All right. Well, we're going to talk about next steps when we come back. I'm Lisa Adams. Welcome back again. Today it's all about fighting the coronavirus with my guest, David Gibbons, president of UPMC Hamot. So all the questions are swelling these days about how we get things back to normal, and I'm sure that's a big question for hospital systems too, as to when you restart routine procedures for people. Where are you on that discussion?
Sure. I think it's important to share with the public that, first and foremost, that we do follow the recommendations from the CDC and other public health authorities. And we've never stopped treating patients that required medically necessary care. And that really is important. As we look to essential care, we continue to provide essential care to patients requiring that. And we are tracking diligently patients that are in the queue, so to speak, for a scheduled procedure or surgery, and working very closely with the physician and with the patient. So that we do have a solid plan in place as we received notification from the public health authorities to really reopen the hospitals in a way that the public has seen before.
How about hospital visitation then for families coming and going? Do you think that will ever return to normal, or you might have more screening all the time for people coming to visit?
I do think it will return to perhaps a new sense of normal, and certainly one that we are closely monitoring right now, and will continue, again, consulting the public health authorities about screening. And I do think screening in part will stay for quite some time.
How are your nurses and doctors and other employees at the hospital doing? I mean, we certainly have seen these exhausted and very stressed medical workers in the New York area, afraid to go home, afraid to spread the virus to their family. How's your staff doing here, and how are you kind of holding their hand through this process?
Well, first and foremost, they're my proudest group. And I describe them in 3 words. They are certainly courageous, they are committed, and they are brave. We, as an executive team, round twice daily on the 7 a to 7 p.m. shift, and then the 7 p.m. to 7 a.m. shift, connecting them with them individually, answering their questions in real time, and we're learning from them as well. So I am very proud of them, and they are doing a phenomenal job in caring for our patients.
We only have about a minute left, but do you have any sense of what the long-term lessons are going to be for UPMC Hamot?
Sure. I think that we looked at this pandemic on the front end, and many people saw impossibility, and I would say that I see the UPMC Hamot team and UPMC as we can do this. We've got this, and we truly have. And as I shared, as I round through the hospital on a daily basis, the team here has it, and we are well prepared in dealing with this pandemic in uncharted territory.
If people ever had a sense, though, of something like that can't happen here, I mean, we heard so much about Ebola and how terrible that was, but we now know it can happen here.
Absolutely, it can. And again, I think it's important for the public to know that we are well prepared to provide their health care and their safety.
Last question really quickly. My mother had a long stay in the hospital a year ago. You round and visit people's families too, I know that. So is that something that you can still do?
Yes, we can, and we still do. And frequently we are now on FaceTime or interacting with the family, or telephonically interacting with the family. So it really has changed the norm, and I certainly think that will continue into the future.
All right. Well, David Gibbons, president of UPMC Hamot, thank you so much for giving us some insight on what's going on there in the hospital during this COVID-19 crisis. And as always, thank you for being with us as well. If you have an idea you'd like us to explore, just email me at ladams@wicu12.com and join us again next time for The Insider.